Hello everybody, I'm Dr. Sonu Mehrotra, practicing in Raipur, that is the capital of Chhattisgarh. Welcome to online repertory training course. Really I'm very thankful to Dr. Kalathia that he has given opportunity to me to speak about repertory, and for last 5 years I'm associated with him, and whatever courses he's organizing, online courses, I always have joined, and really it's very helpful also. About the repertory course also I have joined, and it has helped me a lot. Just I wanted to share my journey, how I have become homeopath. In my family, there are so many homeopaths are there. My father, Dr. S.S. Mehrotra, he also was a eminent homeopathic practitioner. And since class 8, I have remembered most probably, I have joined him. And though I was in a school, but my exposure has taken place at the clinic since class 8. And my sister, elder sister, she also is a homeopath. And multiple cases, you can say, what type of cases I have not seen. I have seen cancer cases, I have seen coma cases. Though I was not having the much medical knowledge at that time, but I used to assist daddy, and daddy used to take me to the hospitals. I was here to prepare the medicine many times. And there's the first exposure, because I've seen such critical cases have been cured by homeopathy, and I've seen from all other pathies where they have failed, our homeopathy has worked tremendously. That has given the impact on my being, I have to join this course only. Since I was with daddy, since I was with my sister also, I was getting confidence also. I remembered when daddy used to go outside, I used to see the patients also. But it was good exposure, very good exposure. Later, when I joined the college, obviously I used to go to college the whole day, morning and night used to see the patients. My father, I have remembered, was very confident how beautifully he used to select the medicines, I can't tell you. And whatever I was practicing for last 25 years alone. My father has passed away in 2004. After that, I'm alone. But whatever he has taught, really, because of that only I'm treating the patients successfully. My father used to say, a homeopath can fail, but homeopathy never fails. And this thing I've found many times. If many times it happens, my colleagues, other doctors also have not successful in one case, treating the case. I have done. If I have failed, others have done. But this is the way, this is a skill to select the medicine. And I found repertory helps a lot. One must have the knowledge about the repertory. As all know that when we are in the college, just for passing the marks, to gain the passing marks only, we study repertory. I did the same thing only. My professor was very good, but I used to cram the things, I used to learn the things to gain the marks. I was not having the much knowledge about the repertory. I knew what is gradation, I knew how the medicines are to be chosen. I've remembered in my repertory exams, and when the practical has taken place, my professor, he gave me a few rubrics to choose. At that time, cant repertory I had, and it was in the course also I selected, and properly I could select. But the meaning, how to select, how beautifully it is to be selected, how skills required to select the rubrics, sub-rubrics. the medicine which came down. Then later, when I joined college, when I joined Dr. Kalathia, and he has started giving the exercises, I started learning. That has helped me tremendously, you know. Then here my son also is pursuing the career in homeopathy. He also started learning. So homeopathy is such a science. I always tell that allopathy is very easy to do because you are having for fever, you are having a certain antibiotic and you are having a certain medicine. But homeopathy, for the fever also, we have to select, we have to see so many things that whether the hands are cold, palms are hot, or head is paining or shivering, which part is shivering, all these things, many other concomitant associated symptoms, so many things we have to select. Then it is hunting for the rubrics, and really when you are able to serve the patient and when the patient says they are much better, really it gives immense pleasure. I can't explain in my words that my colleagues must have experienced these things, and I think students who are in the course gradually they will learn, and they will be able to hunt the correct rubrics and give the correct medicines and see the response of the patient, how well he responds. One last thing also I wanted to tell on my case recently. It is a gift from the side of homeopathy, you can say. My mother, she's 78 years old, and she had gallbladder stone, cholelithiasis, but she never wanted to go for the operation because she was not willing, and the stones also were silent. So was managing by the homeopathy successfully. Once recently in last January only, the January has not come, it's about to come. Then in January she had rupture of gallbladder, and within few hours only, in the morning she had the pain, and by the evening she went into coma. And then doctors had taken her to the hospital, and doctors they put her to ventilator also. The whole case I have given in Homeopathy, you can go through. Then there, first when the doctor, because since I'm a doctor, I was allowed to go inside to the hospital as well as the ICCU also. The first I gave opium. She was in deep coma, and stillness breathing. Her voice also was coming, snoring like. Opium gave in tandem. She was out of coma. After that, her impression was very confusing. Like I used to tell mommy, mommy, so she was seeing me, but like a stupid look, you can say, and then she was rolling the head like this. I asked, doctors said she was having some kind of encephalopathy, but we don't know. We'll go for the all kind of this checkup, that checkup, spine checkup, and scanning and everything. Then, according to symptom, I selected Hellivorus. My friend Dr. Rouse has helped me, and when I gave Hellivorus, from the one dose, you can say 10 m I gave, and because at that time I did not have even 10 m I did not have. I have 1 m, right? Then I gave 1 m, and by the 1 m, after giving the 2 doses only, when in the morning I went there, she was unconscious, and she was telling, Sonu, I'm feeling hungry, and I'm feeling appetite. I have all videos also of that time. One day I'll show to all of you. So I can say if correct medicine, correct rubric, would have not selected my something wrong could have happened. So really, and I'm very thankful to listening me. Just I wanted to encourage everyone. Yeah, and from I practice in Raipur. It is in Chhattisgarh. This is the capital of Chhattisgarh, Raipur. It's a very good place, and I practice here for last 25 years and seen all kind of cases. Thank you, welcome, and let us start now, right? First of all, we must know what is repertory. We can start, and wherever it is required, I'll explain also according to my knowledge. Repertory is a systematically and logically arranged index to the homeopathic materia medica. That is all index, the rubric, in the form of rubrics, sub-rubrics, it is arranged. The repertory helps us to find out the required symptoms together with the medicine or a group of medicine having different grades. If a doctor is very skillful, he is quite experienced, then he select all kind of symptoms, general symptoms, particular symptoms, all kind of symptoms, then he put it together, then he see. Then according to that, some medicines come when you are going to repertorize a case. Then the gradation comes, first grade, second grade, third grade, the gradation also comes. How many symptoms one medicine is covered. Then after that, when the picture comes, then nowadays Dr. Kalathia and Dr. Sankaran also has taught. I have attended many seminars, many conferences, sensation method. Then you select according to, because the present doctor only can feel the patient. When the patient enters, when the patient sitting, the observation starts. The patient sitting outside, and you can observe what patient is doing, sitting calmly or in a hodgepodge way, going here and there, very restless, what kind of movement he is doing, how he is talking to the receptionist, the way of talking. When he enters, then you give the form to him to fill up some idea. When you give the form, you can have the idea that patient here is going, his mental condition. Then you take the whole case. The whole case also is going to be explained by our teachers and our Dr. Kalathia, how to take the case. That is another part. Then after that, you select, then you see in which kingdom, in whether the patient is going mineral kingdom, in animal kingdom, or plant kingdom, or other. Then you see the particular case, and then you see all medicines. Then you see which kingdom, because you have felt the patient is in the animal kingdom. Then you can select the medicine according to gradation, right? Then it is connecting link between the materia medica and diseases. I can say it is the link is there, right? When you have selected, still the repertory is not the authorized one that you have selected. Again, you have to take the help of materia medica. You have to go to the medicine, then you have to see the core of the case, and you have to see whether the core is covered by the medicine or not. So it is a link between the materia medica and disease. And the repertory, of course, after that materia medica is needed. And the disease also, whether the particular, because so many repertories are there, where according to disease also the medicines are given. That also comes. So we can see whether that materia medica, whether this sphere of action is there or not, that particular organ is covered or not. It is a link. Where to use the repertory? It is a very important question, because in certain cases when we are clear, the patient comes, sometimes the doctor is very experienced, he has selected many, he has seen many cases. According to that, he can select the medicine sometimes, and his experience says the patient is going to be benefited by this medicine. The maybe repertory may not be needed, but still it's very useful if you confirm by the repertory. Let us go to see chronic cases where several remedies seem to cover the picture, right? So several cases where so many chronic cases, so many medicines cover, but when you repertorize the case, it gives the then many medicines come, but according to the gradation, you can choose the correct medicine. Mismanaged cases. Many times, many medicines we have given, but still we are unable to correct on the simillimum. Then the repertory helps a lot to select the correct medicine. Case which do not show a clear picture. You have taken the whole case despite of going into the deep pathology or deep into the symptoms, you are not getting the clear picture. But whatever symptoms you collect and you put to the repertory, then you get the medicine. To trace out the probable sequence or remedies that may be necessary to cure. Obvious. You are getting the all medicines one by one which are helpful. To differentiate between seemingly indicated remedies, to work out relationship of remedies, and second prescription. Second prescription also, one medicine you have given, but it has not helped. Then obviously you want to give the second medicine also. Then concordance, that medicine helps you for the second prescription. In those cases, now it's very important where not to use the repertory. In those cases where there are clear indications of simillimum, that already I have explained. The patient has come and you know according to experience or this medicine fits, you can give. There the repertory is not needed. Repertorization. The aim of the repertory is never to replace the materia medica, but to help in final choice of a single medicine. Obviously, you have to take the help of materia medica always. That's obvious. The process of repertorization is essentially a logical elimination of apparently similar medicines. Again, it is clear. According to gradation, similar medicines are there, but you can select according how many symptoms are covered by this medicine according to gradation. Materia medica and repertory are complementary to each other. After jumping over a correct medicine, you have to go to you have to seek the help of materia medica in order to confirm it. Uses of repertory. To find out the simillimum, it helps the study of materia medica, helps to find out a complete symptoms. The knowledge of rubrics and subrubrics helps in formulating questions, which is an essential ingredient in case taking. Like I wanted to tell, one lady came to me, and the lady, she started shouting, I've got pain in the abdomen, doctor don't touch here, doctor don't touch here. When I was examining, then my son is not taking the care of, I want that he should ask me, my daughter-in-law, she's also not taking care. I want that everyone should ask me what is happening, what is not. Here the one rubric I have remembered, that is desire to be carried. Like for the child, we want to carry, the child wants the same old person, any age person. Because when selecting the medicines, the sensation method, you have to see the inner age. What at the age of 60 or 70, the patient can think of, they behave like a 7-8 years old child. This is very important in selecting the medicine. So because I knew the rubric, so I could select the medicine. The rubric I could select because it helps, repertory helps us. It suggests related remedies which could not helpful for selecting a drug for a second prescription. I told you. Repertory helps us to select the right rubric amongst similar rubrics. Many rubrics are given, but according to how you felt the case, you can select the correct rubric. Helps in the study of homeopathy in relation to modern pathology. Many pathological symptoms are given in repertory, and you can see which pathology is involved in particular case, and then you can get them. You can see the rubric, you can see the repertory. It is going to help you tremendously. Synthesis of new rubrics. Many new rubrics are given. Many new rubrics you come to know. Limitations of repertory, of course, when it is a great tool, There's a certain limitations also, like repertory is basically an index. Naturally, it can serve only a limited purpose. So, too much expectations from this tool can cause disappointment. If one thinks that I know the full knowledge of repertory and I have purchased Mac Repertory good version and I'll be able to select the correct medicine, no, this limitation is there. Still, it totally depends on the experience, on the knowledge, on the skills of doctor, particular physician, how he is going to select which symptom is important for the case and how skillful he is going to repertorize the case. It is simply a tool, you know. I think you're getting me. It can never replace a physician's mental application and knowledge of materia medica. I told a person is having a, like in that case also, I knew that I had the knowledge of materia medica, this symptom I could select that to be carried. So it was something related to knowledge also. Repertory is like a tool and much success depends on the skills of practitioner using it. I told, totally depends. How skillful you are, how much knowledge you are having of repertory. Now the classification of repertories. There are more than 200 repertories existing covering various aspects and helpful for different purposes. Hence, it is necessary to classify them, obviously according to the use. But no standard classification prevails. The most comprehensible classification would be as follows. First, based on philosophic concept. These repertories have distinctive principles of their own. Repertories have their own distinctive philosophies. They are further classified into based on concept of general to particular. Here the generals are given prime importance, then follow characteristic particulars. Example, Repertory of Homeopathic Materia Medica by Dr. J.T. Kent. B. Based on concept of particular to general, on philosophical concept of totality. That is, first, based on doctrine of analogy of and concomitance. Example, Therapeutic Pocketbook by Dr. Boni Hassan. Based on complete symptoms, concomitants and pathological generals. Boni Hassan's characteristic and repertories. Second, repertories having no distinctive philosophy. They are also called concordance repertories, relationship. These repertories are mostly used for the purpose of reference and not for systematic repertorization. Example, Nail repertory to herring guiding symptoms. Clinical repertories. These repertories have many clinical rubrics under different systems and medicines are grouped against the name of the disease. Example, covering whole body, Borix Materia Medica, repertory. On specific parts, Morgan's urinary organs with eyes. Third, on clinical condition like Bell's diarrhea, Allen's repertory of intermittent fever. Fourth is card repertories. Slips of cards arranged systematically facilitate the work of finding out remedies. The example, Kishore's card repertory. Dr. Jugal Kishore from Delhi, he was very eminent doctor and he introduced card repertory. P. Sankaran's card repertory by Dr. P. Sankaran, the father of Dr. Rajan Sankaran. Mechanical added repertories to facilitate and expedite the work of repertorization. Mechanical devices were added to the field of repertory. The whole repertory as well as the process and method of repertorization are put in the forms of software. Some computer repertories are Radar, Mac Repertory, Dolphin. All these repertories are doctors are using. Mac Repertory, like I'm using, it's very good for the sensation method. Everything is given, and time to time they upgrade also. Methods of repertorization according to Dr. D.K. Sarkar. First, Dr. Hahnemann's and Bonnie-Husson's method, where complete symptoms are available. Dr. Kent's method, where generals, mental and physical, and particulars are available. Third method, where mental symptoms are lacking. Here, one starts with the physical generals and then particulars. Right? Fourth method, where generals are lacking, selection of remedies is made on the basis of a striking peculiar symptoms, and then the remedies are differentiated with the help of other symptoms. Here we are going to select according to peculiar symptom, what is peculiar in the case. Fifth method, where the case presents only common symptoms or a pathology. Here the physician makes use of every means at his command. Sixth method, technical nosological terms are selected as name headings. This according to pathology, according disease name according to. One by one we are going to take the repertory. Boker Bonnie-Husson's characteristic and repertory. It is called DBCR in short form. It needs to be understood along with its main philosophies, Doctrine of Phenology, Doctrine of Concomitance, and Doctrine of Generalization. If the main symptom is there, and according to that, what concomitants are there, what associated symptoms are there. If the headache is there, along with this, what modalities are there, what other symptoms patient has got. And Doctrine of Generalization. Here the doctor has selected, if one particular part is selected, he used to take the whole general. The patient, other parts also are affected like that. This philosophy is being used. When to use in cases where more modalities and concomitants are there. Aggravation, amelioration, concomitant symptom already told you. Cases where the pathological and objective symptoms are more marked, where the pathological symptoms are more marked. Obscure cases, short case history, very short case history is there. Cases with insufficient symptoms with few or no mental symptoms. And especially fever cases, it works beautifully, I'm telling. No other repertories I have found works better than this repertory. Because in beautiful way they have given the modalities and the particulars and all. You select the medicine according to Dr. Bonnie-Husson, Boker Bonnie-Husson, you will never fail. Some interesting mind rubrics given DBCR which are not given in synthetic repertory even. Mind, alcoholism, mind, buffoonery. Many of these rubrics have been added in complete repertory. However, the technique of using it through DBCR is different. One of the most useful sections in this repertory is the fever chapter. I told you. When not to use the DBCR, some limitations we have got. Mind symptoms are not prominent. Craving, aversion, physical generals are more clear. Clear-cut physical generals are available. And emotional level delusion level cases. On the mental symptom delusion level, the patient emotionally affected. We are going to take the one case of dengue. 30-year female diagnosis with dengue, suffering from past 3 days, platelet counts 30,000, fever 104, allopathic medicines were not helping, they were helpless, dry cough, constant no thirst, salivation during cough, fever, unable to sleep since then. Which part has more heat? Heat especially felt in the ear, face, eyes, eyelids. Do you feel chilliness? When the doctor asks, she says no. How did it start? Patient says, had coryza, and post that it started. A state of mind feels dull, doesn't feel like talking much. Appetite does not feel like talking than eating. No other symptoms. Family are in panic, obviously. Remedy, arsenic album. Here the analysis already I have given here. What medicines, what rubrics are taken here. Pathological type is cattle. Concomitants, cough, dry, tickling without thirst. Cough, concomitant, saliva flow off. Fever, concomitant, sleep, yawning. Fever, concomitant, sleep, sleeplessness. fever, partial heat, ears on, that is given. Fever, partial heat, eyes and eyelids. And here the arsenic is covering maximum symptoms. Remedy arsenic 30 was given. In follow-up, she has improved tremendously. Fever subsided within 2 days, thirst increased, sleep improved, did not feel like eating. Follow-up 4th day, appetite came back. No allopathic medicines were given, was able to do work, everything. This is the beauty of repertory and how skillful if you are selected and see the result. Second is Repertory. Repertory is based on hearing guiding symptoms, which has many constitutional clinical rubrics associated with characteristic symptoms. So a particular mind or physical particular symptoms may be associated with that clinical diagnosis. So a specific rubric based on direct prover's language as they are, pure as it is given. Where to use the Repertory? This repertory has a lot of clinical rubrics which are especially associated with age, sex and pathology. Useful in cases where the mind symptoms, dreams and fear are not so prominent, when patient is not at the delusion level. An eminent feature of this repertory is that the symptom is not converted into rubric. It is given directly in the prover's language. It's more easy, you can say, because you're here the patient language only you are supposed to see, as it is given. Another major use is when there are two separate pathologies are there. Like in Mind's chapter, rubric cheerful, subrubric cough, with chronic only remedy lycopodium, where circulation, palpitation, annus fistula only remedy cactus. Means the patient when during the cough the patient is cheerful, very peculiar symptom, the medicine is given. When the palpitation, circulation is there, palpitation, and along with palpitation patient has got the anal fistula also, means two pathologies are involved, then the medicine is given here, cactus. One case we are going today, case of pleural thickening. 28 years old male had sudden difficulty in breathing post pleurisy, cough with chest pain, unable to do anything. He has to take Ultracet daily, allopathic medicine. Describe the pain as if someone is sitting on me as if pressed. The patient's language. Unable to move during the pain. Any other symptoms? Had developed joint pain with this cough. Nature. He is a very friendly person. He is talkative by nature. Once he starts talking, he doesn't stop. Very loquacious. Not scared of anything. He is DJ and has interest in event management. No dreams, no fear, no delusion level. Doesn't open up much. Here, if the pleural inflammation pressing remains impeding breathing, cerebric is taken, abrotinum. Loquacious, talkative, again abrotinum is there. Troublesome because he was having the concomitant rheumatism, again the abrotinum. Remedy abrotinum 30 every month. Now the another repertory is Cant repertory, which we have studied during the college days, and it's the base, you can say, for repertory. It has sharp mind rubrics with lesser remedies, hence it can be used in cases where mind symptoms are very clear and when there are characteristic physical particulars. Right? General symptoms are also emphasized in Cant repertory since he stressed the working out of a case from general to particular. Right? And then cross-checking the remedies picture. It helps understanding the drug picture, like chapter, mind, rubric, lamenting, sub-rubric, appreciated because he is not. The only remedy that comes up is Kalathia salve. Now this sub-rubric often becomes the main genius of the remedy because especially there is no single drug rubric. The patient is sorrow, very grief, crying because he is not appreciated, and the medicine single is Kalathia salve. Boric repertory, it is a clinical repertory, hence It is of a major advantage in cases where characteristic symptoms are unavailable only clinical diagnosis. This is very important. If a person is not having much on the knowledge of mental symptoms, this where the pathological things are given, clinical diagnosis, Kalathia is given, disease name is given, nomenclature like, then this repertory helps a lot. This repertory compilation is mainly based on the Materia Medica by Dr. William Borwick. There are also many clinical rubrics like chapter ailments from angioma, where the only remedy is abrotenone, chapter ailments from atrophy, where there are 3 remedies. Now the another repertory, Clark's repertory. Dr. Clark says this repertory is designed for use in the study of the Materia Medica and an instrument for finding out the indicated remedy. Practical application. A strong causation given, exciting factor is there in a given case. If you are out, you are having the pain in the throat, the causation is exposure to the cold, then this causation is given. Constitutional features of the patient is very prominent, then this repertory is very helpful. It has 3 main sections: clinical, cause, temperaments. Pathak repertory, as everyone, Dr. S.R. Pathak, when to use, not to be used to find characteristic symptoms or local symptoms. Second, in cases where genus and general is dominant. Main principle of using Pathak repertory, generalize the local symptoms. Generalization, grand generalization. Again, pain in the abdomen, that it can be applied on other parts of the body too. Dr. Pathak says when the cup is half full, it is also half empty. While interpreting the symptoms, try to look at the same thing from various angles. This is the way of seeing the case according to doctor. One case of osteoarthritis of knee. A 70-year-old lady came for the osteoarthritis of the knee. Her knee was swollen and she was unable to move her ankle due to ankylosis. Her hands and feet were deformed due to chronicity of complaint. When I asked her relative about her, they said she was very quarrelsome and abusive. She would curse, especially at her family members, daughter-in-law. She argued with all of them all the time. Remedy, Kalathia. The rubrics are selected from Dr. S.R. Pathak's repertory. Pathak repertory, arthritic deformance, abusive, scolding, quarrelsome, children and family too. See how the particular rubrics are given and how we have changed the patient language to the repertory rubrics. Pathak repertory, dropsy, edema. Here the pathology is given. Joint affected in general, ankylosis, curious fit. Medicine from Kalathia. Kalathia was given. She was receiving Kalathia 1 dose every month for 6 months. Her arthritis and knee complaint improved gradually. There is improvement in the level of deformity as well. Mentally, she became calmer and abuse also reduced over a period of time. Her relatives were happy as her temperament also has changed for better. Some new repertories are there that is given in Mac repertory recently. When I bought the Mac repertory advanced version, there this is given, very helpful. Just I wanted to give the little idea. Recently, in past few years, many newer repertories have come up, which in coming generation will be useful as the disease patterns are changing. Marsh clinical repertory, Q repertory, Massimo repertory, Nilles repertory. Marsh clinical repertory. Here, this is one of the clinical repertory where the clinical conditions are given, next to which, especially the allopathic remedies which can be used in potentized form, have been given. This is repertory has been used often in cases when none of the approaches act. Example, in rheumatoid gynecomastia, testosterone is one of the remedy. So, in this way it is given. In the gynecomastia, testosterone, they give the hormone, and that the potentized form in homeopathy it has come, that can be given. As maybe after giving the testosterone allopathic medicine, the side effect of gynecomastia has come, then also this can be taken. Q repertory. This is modern repertory based on mental qualities by Jeremy Shedd. It's very useful. Dr. Kalathia has taught us to use it. A secure repertory is where the ambition is there, where the animal qualities is there, where light and water qualities are there, where the spider is there, where there's a guilt is there, where the money matters a lot. This you can with other repertories you can take the help of this medicine. This repertory also is very useful. A Sonu repertory, the repertory based on the clinical provings and clinical experience of Dr. Sonu. Case of it, here one case we are going to take is the delayed development. Case of a child with delayed development would have many cravings and desire for food. He had a habit of masturbation, would have constant feeling to have opinion, especially raw, onion, especially raw, meat, sweets and vegetables. On studying the case through different repertories, I could not find a remedy which could match the entire state. So when I studied Massimo repertory, I found Bufo was the remedy which has matched the entire state. Like this it can be given. Now Millie's repertory, published in 1995 by J. A. Millie. The main idea, what the author felt was the rubric which was constructed did not have the essence of the proving, completed and exact feeling. So he constructed this repertory to go the depth of the feeling in a particular rubric. Like, if we study the rubric unjust, accusation, incomplete repertory, two remedies are given strongly, higher Samus and Stephaiscalia. Then here, if but then Millie's repertory, given in the depth, what is the essence proving of both the remedy in the rubrics? Like, why the patient's feeling accused? He imagined that he had been especially singled out. Or maybe the patient accused of theft. Or like that, what the theme is there, that is given by Dr. Millie. It is also helpful. Steps of repertorization, case taking, recording and interpretation, classification and evaluation of symptoms, that is analysis, defining the problem, erecting a totality, that is synthesis, selection of a proper repertory, repertorial result, analysis of repertorial result and prescription. Case taking. Case taking is first step and the outcome of treatment entirely depends upon the success of this first step. Any mistake committed here would certainly interfere in the selection of the drug and planning of the treatment. I have explained that earlier also. It totally depends how skillful, how knowledgeable the doctor, how experienced the doctor in taking the case. If your case taking is not perfect, if certain peculiar important symptoms you have left, you will never be able to repertorize properly and never be able to reach on the simile one. The repertory is a tool only, and still it totally depends on the doctor's knowledge and how skillful he is. Recording the interpretation. For effective repertorization, precise recording is very crucial for proceedings further with the subsequent steps. Recording we do generally for presenting the case also. Sometimes when the patient comes, he tells something, then we forget next time when the patient revisit us. So just what we have to do, we record the case for an evaluation of the case. It is an important skill of the physician to transfer all the data in exactness, exactly what we have taken to the patient, as it is received from the patient to the case record. A slight modification during data recording may occur while recording the case, but care should be taken to keep the meaning of the patient's narration as natural as possible. It's very important. Because what the patient says, the one word also may lead to another rubric, and again your result is going to be affected. So, classification and evaluation of symptoms. After the case is taken fully and recorded well, a physician is in possession of quite a large number of symptoms which need to be analyzed, classified and evaluated in order to understand the importance of each symptom to be used for diagnosis of the disease as well as the person. We have to see. And again, here again, how much study you are having, how much symptoms you will be able to evaluate it, totally depends. All symptoms are either general or particular. A general symptom, all symptoms are either general or particular. A general symptom is one that affects a patient as a whole. Right? They include mental symptoms, physical generals, and pathological generals. Obviously, mental symptom, physical general, pathological generals generally they affect the patient as a whole. Second, a particular symptom is one that affects a single part or organ. They include sensation, pain, pathology, discharges, modalities related to the part. Sensation, what kind of hammering sensation, what kind of sensation the patient is feeling, what kind of pain the patient is feeling, the patient is having this suffocated, any kind of feeling. Pathological symptoms is which pathologies involve particular which organ. Discharges particular to the organ. It may be epistaxis, bleeding, it can be leukorrhea, any discharges. Modalities, aggravation, amelioration to a particular part. Defining the problems. An analysis makes the whole expression clear to the physician and helps to define the problems at different levels. Erecting a totality synthesis. Totality is not the sum total of symptoms. It is the logical combination of the symptoms which characterizes the person as well as individualizes the problem. All symptoms taken and gathered together and put together there, it's not like this. We have to distinguish mental general, physical general, particular, then we take the symptom. Selection of the repertory and repertorization proper. After the totality has been erected, the case becomes clear to the physician. If a case were full of generals, Kant's repertory would be the best selection. If it has got pathological general, bogus repertory must be used. If the case has got a particular with location, sensation, modalities and concomitants, with a few mental, therapeutic pocketbook is preferable. However, bogus repertory can also be used. Synthetic repertory can be used for Kant's method to refer to more generals. Medical repertory can be used where generals are more prominent. Repertorial result. A group of close-running medicines should be noted down according to the symptoms covered and marks obtained. Then, that already I have explained. Analysis of repertorial results and prescription. The remedy which gets the highest marks is not necessarily the final remedy in all the cases. Repertorial in the result should be finally referred to in the court of materia medica. Sometimes when we select the, when we take the all repertorize the case after taking the whole case, the first medicine arsenic, it's a mineral remedy. But if the patient belongs, we have felt that it is animal kingdom, and maybe on the fourth and fifth the medicine is coming which is belongs to animal kingdom, but it is on the doctor's skills and knowledge and the feeling and the core of the case, it depends that which medicine you are going to select. Again, this is knowledge. Repertory also, I've seen repertory, whatever repertory you are going to use, the aim and the goal is same and all, it is like, different paths are there, but they'll be reaching on one goal only. If whatever complete repertory, synthesis repertory, whatever repertory you are going to use, they will reach on one minimum only. I've found this thing. The way might be different. As the last, I'm very thankful to all of you that you have heard me, and whatever knowledge and whatever I could gather, I have put here, and I'm thankful to again Dr. Kalathia, who has given the opportunity to me. And let us start, because the course very soon is going to start, Repertory case, and I'm very sure that all of you are going to be benefited by this course. So all of you join and let us study together, grow together. And now myself, I'm Dr. Sonu Mehrotra from Raipur. Now take a leave now. Thank you very much. Thank you.